Hello, you're listening to the Natural Healing Show for UK Health Radio. This is Catherine Carrigan, medical intuitive healer and Amazon #1 best-selling author. You can find out more about me and my work in natural healing at catherinecarrigan.com and unlimitedenergynow.com. While you're there, sign up for our newsletters to find out more about natural healing. Now, our guest today is Kathleen Gramzay. Kathleen is a 17-year board-certified massage therapist, educator, author, and developer of the Kinessage Release Your Pain self-care system. She works with wellness consciousness individuals and businesses who know that life is not fun or productive if you're in pain or can't move right. Now, Kathleen and I connected because of my most recent book, The Difference Between Pain and Suffering, which is about how to get out of pain naturally without drugs. Now, this is such an important subject because the leading cause of death for Americans under the age of 50 now is actually drug overdose, and 91 Americans die every day from opioid overdose. So through the Kinessage system and trainings, Kathleen teaches you how to be pain-free and move with ease so that you can focus fully and enjoy your life. So, welcome, Kathleen Gramzay. And will you share with everyone your website?
Yes. Hi, everyone. Well, good morning. My website is my name. It's Kathleen Gramzay, www.Kathleen with a K. Gramzay, G as in George, R-A-M-Z as in zebra, A-Y.com.
So, Kathleen, what is Kinessage?
Kinessage is a series of specific movements that you do that activate your nervous system to release chronic muscular pain and tension, head to toe, skin down through the deep muscles and connective tissue.
And what prompted you to develop Kinessage?
Of course, it was my own pain. 1 year after I started my massage therapy practice in 2000, I was a deep tissue therapist, and literally my body was killing me. And I realized I needed to find a smarter way to work or I was done. And I had studied and taught anatomy and kinesiology. And I thought I knew that I could, if I could figure out a way to use the body's design for movement instead of force to do the work, that I could continue doing what I loved and my clients could have kind and effective work. And so I did that, and I translated my self-care movements into this method of massage that I named Kinessage. And then a few years later, I had this great results, and it was kind of like the universe saying to me, okay, well, why should this be for you and your clients? So then I became a national CE provider and taught it around the country to occupational, physical, and massage therapists. And then in 2015, the opioid addiction epidemic caught my attention in a big way, and I knew that I needed to bring this to the public. So that is when I took all of my 17 years of teaching and practice and put it into a virtual system so that anyone could release their own muscular pain and tension without drugs or need of a practitioner. So Kinessage is really two parts. It's my book, which is Release Your Pain, Expand Your Life. And that's an owner's manual for your body mind. It explains how it really works and how you can partner with it. And then that's paired with the 38 movements that I created and proved through thousands of clients and hundreds of therapists, where you follow the movements and your nervous system does the releasing. So it's a system where people can empower themselves to improve their well-being rather than relying on the belief system that we've been conditioned to, which is that pain relief either comes from out of a bottle or someone else has to fix us.
I just really appreciate what you just said, because so many people who are in pain think, well, I really want to get serious relief. I have to go to a doctor or I have to take drugs. But you and I both know and work with countless clients who are on, a long list of medications. They're getting injections every week and they're still miserable. Yeah. So I know that we're both very passionate about sharing this information. Now, most of us who are listening to this interview are going to be listening. So can you describe for us some of these Kinessage movements? What do they actually look like?
What it is we are designed to move. And so our body has our sensors. So when you pick up a glass, for example, when you pick up a glass of water and your fingers are taking in information about that glass, the size of it, the shape of it, the texture of it, and your mind is also, your body is also taking in the information of how much motor unit or how much muscle tension do you need to pick up that glass. And then what kind of tension of muscles around your lips do you need to circle the glass to be able to drink the glass without spilling the water down your shirt? So what Kinessage does is it uses the receptors in the body. It uses our sensory receptors, the mechanoreceptors, the joint receptors. It uses everything that the body's designed for movement in reverse to reduce muscular tension. So have you ever stubbed your toe, like going in the bathroom in the middle of the night, right? Or slammed your thumb in the drawer? What's the first thing you, besides cursing maybe or saying something, what's the first thing you do typically?
Clam
do you
up.
hold it? Yeah, clam up, or you like step on your foot to hold the pain, right, to swell the pain of your thumb. Well, this uses very light intentional compression, and it's really the more loving touch you use, the kinder you are, the more the nervous system responds, because the nervous system is very sensitive and it takes information very easily. We're used to this, like it's got to be hard, like beat 'em up deep tissue, or PT, like it's going to hurt. It's got to hurt first and then it's going to work. Or if you go to a chiropractor, it's got to be like this big crunch and then you're adjusted. With the body, actually, when the body releases tension, there is no noise, there is no big pain. It's quite the reverse. You're using very simple tension, but where you're placing your hands are exactly in the places to maximize the number of those receptors you're using, so that as you just do these movements, it's just very simple movements, and it's moving the joints through range of motion, but in a very specific way that is using this anatomy shorthand that releases the muscular tension through the layers.
You know, I think that's a great explanation, and I've taught yoga for 21 years, and when I'm working with people therapeutically, because my book, The Difference Between Pain and Suffering, like you, I use movement. And what I find is that there's two sides of your nervous system. The sympathetic side of your nervous system, which responds to stress. Like you said, the first thing we do is tighten up. And the parasympathetic side. And when I was working with people in pain, back pain, shoulder pain, knee pain, hip pain, neck pain, one of the common denominators that I find is, in simple terms, you have to teach people to relax, which on some level is self-evident, but on the other level, we all know we should relax, but it's literally getting your nervous system to let go and
Correct.
your muscles to release.
Correct.
And the letting that tension, as you say, out of the body.
Right. And in fact, we are so on the same page, Catherine, because it's the same thing. I teach the same thing. And that's what this system does, is we carry chronic tension all the time. So if you think about the fact, like, especially, yoga, and you're experiencing this as well. So for people who aren't familiar, it's kind of like we're marionette puppets, and we have 4 strings, one in the front of a muscle, back, side, and side. And so when those muscle strings are equal tension, then the force comes through the joints perfectly as designed, so that we don't have wear and tear on our joints. We don't have issues. But what happens is people establish imbalanced chronic tension patterns through how they sleep, how they drive, how they work, what affects them mentally, that they see somebody and they tense up, or whatever their circumstances are. So we have these chronically held imbalanced tension patterns that now take the force through the joints incorrectly, which causes wear and tear and causes the chronic muscular conditions like sciatica, carpal tunnel, thoracic outlet syndrome. All of the chronic muscular skeletal conditions are, the underlying cause is chronic muscular tension. And so what Kinessage does is actually bring that awareness back of what normal tension is, because it literally is out of the awareness. When you hold tension over time, your body thinks that is normal tension. Right? See people, they'll have their shoulders up by their ears and they're so tense, their shoulders are like wearing earrings, and people don't like, what do you mean? What do you mean my shoulders are down? Right? Or people will say, I didn't even know that was tight or sore until you touched it. Right? It's out of the awareness of the nervous system. So when you can bring back that awareness of how muscles naturally, voluntarily contract and let go, then people can do what you're talking about, which is to be able to relax, because people think they are relaxed. And then you say, oh, just sit heavier in the chair and feel the chair holding you. Like right now, anybody who's listening, they could just take a deep breath and just settle into the chair and feel the chair supporting you. And you can sense that your body was holding tension you didn't even know it was holding, and you can let that go. So it is critical, and it is the underlying cause of most musculoskeletal disorders.
I just so appreciate what you're saying. Now, I know that for our listeners, you're offering a giveaway of your book. Tell us about the giveaway, because
yeah, it's a free excerpt of my book. So when you go on my website, KathleenGramzay.com, you can sign up for a free excerpt, and that'll give them a taste of what this system is about and what the concepts are about of being able to partner with your own body mind.
Yeah, it's so important, and it's so crucial that people share and this information about how to get out of pain without drugs. When I was growing up, the leading cause of death had nothing to do with drug overdose.
Right.
So, again, we've gone from, using a little bit of medication to becoming so drugged up that it's killing us.
Honestly, yeah. And I've done a lot of research, and I speak to many companies and groups, and the stats that you're talking about. I mean, 2015 opioid overdose has surpassed deaths by car crashes and gun violence. I mean, that's extraordinary, and half of which are prescribed, half of which are opioids, prescription opioids. And it's become the treatment of choice, because doctors prescribe it, and because people don't know that there is other options, that they can actually work with their own body mind, and they can release their own pain and tension for many, many, many of the disorders that people think, because they've been conditioned, that they have to go to somebody or they have to take something. So really that's why we're both doing what we're doing, is to help people realize you have this extraordinary vehicle that you live in that has an innate intelligence, and you can direct that intelligence, and you can work with that intelligence. And in working over 17 years with, thousands of people, I can tell you how many times I saw people literally walk in on a cane and leave without it and be able to walk fine, because all they needed was to be able to, to reset the nervous system and the muscular system, and then to be able to give it the assistance it needs, right? It just needs a little bit of assistance if you know what to do or how to do it.
Yeah. Kathleen, I know you and I share the opinion same opinion. Many people know more about how to operate their computer or their car.
Exactly.
Than how to operate their body.
Yes.
And the belief is, if your body gets broken down, you go to a doctor and you take pills and then you get better. But here in the Natural Healing Show, what I'm about is really empowering people so that you learn how to take better care of yourself.
Exactly.
And
I like it.
And that brings us to self-care. So self-care is a broad definition, Kathleen, that means different things to different people. What is your definition of self-care?
Well, like you said, a lot of people have different ideas. Sometimes self-care is getting a massage, or going to see a movie, or relaxing and vegging out watching TV. I mean, or taking a bath. It could be lots of different things. For me, self-care really is a very practical form of self-love, because when you recognize we live, 7.2% of our body is our head. That's it, 7.2. The 92.8 of us is everything else. And so we have this body mind, and people don't live in it, they live in their heads, right? We're always tied up, lost in our thoughts of either what we want or what we don't want, and the emotions that surround those things. So just by taking your attention down into your body and feeling what it's like, oh, I'm in here, right? I can feel them. This is not just carrying my mind around. There's all this other living aspect of myself that has its own gifts that it can bring. And just by simple paying attention, simple things of being aware that you have a body. And so self-care to me is recognizing and learning about this vehicle that you're talking about. Like, I liken it to a cell phone. When people get a new cell phone, it's like, okay, I have to put a little dedicated time to learn this. Like, I have to figure it out, because basically here's this great technology that's supposed to be helpful to you, but you have to learn how it works. Once you learn how it works, it makes your life easier. Well, there is nothing that applies to greater than your own body. And so when you take the time to learn how it works and how to work with it, then we're designed to move. It feels good. There's a reason why babies and cats, when they wake up, stretch. We're designed for that. Everything is predicated upon that. So when you start to see it as you get to move, you get to feel how great that feels. You get to have more energy. You get to be invigorated. You get to be excited about your life because your body is a partner with you, because you are now treating it. I posted something yesterday, which was, do you see your body as a friend or foe? Do you treat it as a friend or foe? Because most people, when we're young, our body is our asset, especially for women. It's our asset. We utilize it. And then all of a sudden, maybe in your 30s or 40s or 50s, it's not the quote asset on the external side, or it starts having pain, and now people start thinking that their body is betraying them. And actually, it's just communicating with them. It's just trying to tell you pain is a way of the body saying something is wrong and needs attention. It's not trying to get you mad. It's not mad at you. It's been holding everything that we don't contend with mentally, emotionally, spiritually, physically. It's the container that is holding all of that. So when you get that and you go, oh my God, thank you for holding all that all these years, all the stuff that I couldn't handle. Thank you. And you start giving yourself stuff, just simple stuff, good rest, good, clean, fresh water, especially pH balance, if you can do that. Nourishing food, anything that you do, but you're mindful that you're not stuffing this inanimate thing. You are feeding a living, dynamic vehicle that everything, whether you're feeding it with your thoughts, with your emotions, with the food you put in, with the whatever liquids you put in. And then you start to see that this is actually my best friend. It's been taking care of me, and it becomes joyful. Like, I'm sure I would have been, doing yoga, when you do yoga, it just feels great. And when you're done, you're like, oh my gosh. And you realize, well, yeah, because it is communication that I'm having with the body. It is beneficial and loving, and it's supporting on every level.
Kathleen, yesterday I was doing a medical intuitive reading with a client in Australia who has long-term chronic fatigue and fibromyalgia. And we were talking about this issue of movement, like you're talking about. And she said, well, a lot of times I just don't feel like moving. And I said to her, you're asking the wrong question, because she was asking, do I feel like moving?
Right.
And I said, what you need to ask is, do you feel like getting better?
There you go.
Do you actually want to be healthy? Do you want to get over this? Because when we don't move, as you know, our lymph doesn't move. The only way to move the lymph is by exercise, massage, deep breathing, or drinking water. Your heart pumps the blood.
Yes.
You said you're born to move. And when we stop moving, that's when pain occurs. That's where death occurs. Life is.
Yeah. Yes.
And even emotionally, this lady felt hopeless. Yeah. And I'm like, okay, well, you're literally congested energy. So you've got to get into motion. And motion is energy in motion.
Exactly.
If you're feeling stuck, one of the simplest things to do is get unstuck and start moving. Go for a walk.
Yes.
Very simple. Do some Qigong.
Yep.
Now, this self-care, so if you could share with our listeners, what do you do to take care of yourself?
I have come to really it's become my lifestyle, right? So the coolest thing is you start with little things and you just do them, because we're talking about habits. Habits of, like you're saying, you're the woman you were talking about, I don't feel like moving. Well, there's inertia. If you haven't moved, you're going to stay in the place of not moving. you have to you have to shift the inertia. So you have to start and change the habit or the pattern. So for me, for self-care, it always starts out every day with meditation. That's the first thing I do. That's how I start my days. And so what that allows me to do is it allows me to connect into the deeper aspect of who I really am, which is that consciousness, that observer. And I have a mind, and I have a heart, and I have a body. I'm not any one of those three things. And meditation is the practice that allows me to direct my mind. So you have to have mental discipline, and meditation gives you that. You're practicing quieting the mind. It doesn't mean you don't have thoughts, but you can have them and you can watch them rather than lose yourself in them. And now the next thing you're doing, you're think-a-tating instead of meditating because your mind's scattered and you're going everywhere. So the first thing I do is meditate. The next thing I do is I do my choice of working out. So for me, I don't see it as working out. I just see it as actually, it's joyful. So I ride a bike. So I bike, I hike, I rollerblade, I jump rope, and I have a mini trampoline. And I just rotate those through the days of my week. So like I basically give myself, I get up early so that I can give myself my first 3 hours of my day. So it's those two things. And then I have my mental practices that I do for directing my mind of what I want to do in that day, how I'd like my day to go, what I have that I want to move through with ease, so that no matter how busy my day is or how many things on my to-do list, I can be present with each one, which actually makes time expand. It's the most amazing thing. If you have a really busy day, and I have everything calendared and scheduled, I have things that give me notifications so I can be focused where I'm at right now. And then, okay, it's going to come, the next thing is going to come up and say, okay, your next thing is perfect, because then I can be there. So it's always about being present where you are, and you'll be, people can be amazed at when you do that, being present, how your day feels like expands or the moment expands. So that's what I do. And then I just take that presence through my day, and I check in with my body a lot. I see from how I'm sitting or how I'm feeling. If I start to get emotional feelings in my heart, I look at that, like, okay, what's that? Or if my mind starts a lot of chatter all of a sudden, like, okay, what's going on? Because I can tell my mind starts to chatter a lot, or my heart starts, if I get tense in my heart, I know that something, my autonomic, my sympathetic side of my nervous system is kicking in. And we want to keep it in the rest and digest side, which is where you're able to focus and concentrate and keep your immune system working, keep the chemicals that are flowing that are supportive, rather than the stress chemicals, which take you out of your game and contribute to disease.
I find so many of the people that I interview here on the Natural Healing Show, we all have similar self-care. It begins with prayer, meditation. It includes movement, includes healthy food. And just simply by doing these things, this is natural healing.
Yes.
It doesn't come from a pill. It comes from how you move.
Yes.
Now, how do you feel like this kind of self-care can benefit other people who are in pain? What's your observation?
Well, my observation is when people are willing, because it takes willing, like you said, how do you feel like not moving, or do you feel like getting better, right? It's a decision. You have to decide that what you've been contending with or how you've been living your life, if it's not supporting health and joy, then you are the person who gets to change that. And we decide how we live our life. So the first thing is the decision to start making simple choices. When you have a choice of sitting on the couch or moving or taking a walk, you say, okay, I'm going to take a walk. It doesn't matter if it's 5 minutes. It doesn't matter if you stand just sitting at your desk, you get up stand up every 15 minutes, start there. Or drinking water instead of having 3 cups of coffee, or just drinking water to half your weight in ounces a day in fresh water. Choosing to have the more healthy choice of food. Whatever your choice is in the moment, you don't have to worry about, I'm going to do it for 30 days or 90 days or whatever. You can just say, in this moment, right now, which is the only moment there is, I'm going to choose what supports me to be mentally, physically, emotionally calm, peaceful, and happy. And that becomes your life. And it's a natural progression. It's not this big deprivation. It's a beautiful support that just starts feeling so good that you get the inertia going the other way. And now you're like, you have a choice. You're like, sugar? No, thank you. Right? Or like coffee? No, I'd rather have a green drink. Or, you know, you can, with movement, you can increase your own life force and your own energy through movement. So if you want to get more energized, stand up and run in place, or just, you know, breathe, like you're saying, deep breathing. There's so many simple things we can do. And that's how people can start to shift their life.
I really appreciate that you bring it all down to a question. You know, what can I do right now to feel better? Even if it's just one thing, like think a more beneficial thought.
Yeah.
Right. And so much of this self-care becomes self-reinforcing because, I mean, I've got my green drink here, or I just realized I just drank it already. I'm done.
I'm having a sip of my water.
Okay. But just by doing these things, you keep doing them. It becomes a lifestyle because it helps you feel so much better.
Yes.
Now, what are some of the signs people are not paying attention to that they're, you know, when your body's really speaking to you? What are some of the signs that people need to pay attention to?
Erratic sleep, digestion issues, elimination issues. If you are living on Pepsid AC or whatever any of those, you know, gastric stuff is, if your skin gets really dry, if you're irritable, if you get irritable a lot, if you have trouble moving, doing normal things that anybody, you know, the design of the body is to last you your entire life to move. So if you're having trouble with getting out of your car, or, you know, stagnant pain in your shoulder blades, or any kind of chronic tension, that if you're always holding your traps, like if you always have your hands on the shoulders trying to massage it, those are clues that you are holding all that chronic tension, and your body's trying to tell you, hey, remember, here I am, help me.
I joke with my yoga students that I'm here to stamp out slumping in my lifetime.
I love that.
I'm joking because it'll never happen. But, you know, when we do slump, we develop that hood.
Mm-hmm.
You go into that rounded upper back, and the upper trucks, the top of your neck and the top of the shoulders gets so tight.
Yeah. When you're talking about that spot, which, you know, has been called the dowager's hump, it's very common because it's a place where congestion happens on a regular basis. And particularly when people are sitting all day, their face is in their computer screen, or their head is down looking at their device in their hands. So what happens is that congestion happens, and then the muscle tension, which starts that curvature. But Kinessage, there's actually 2 movements in there that there's a whole series of. Each segment is for different body parts. So for the neck, but it's about bringing that awareness of normal tension in the front of the neck and the back of the neck. And I did a quick 1 hour presentation for a company, and I literally did 4 movements. And this one in particular for the dowager's hump was one of them. I saw one of the women when I was. This is the Wellness Council of Arizona, and they brought me on as a provider, so I was doing a little presentation for them to start. When I saw the woman a month later, she was in her 30s, she came up to me, she's like, look, it's gone, my dowager's hump's gone. And it was like, it is gone, because the body is so resilient when you give it the tools for it to be able to fix itself, which it does, it's self-healing, then those things can happen. So I'm with you on I'm stamping out slumping in my lifetime too. So I didn't know we had that common cause, but I love it.
Yes. Now, you know, people talk about our body-mind connection. Mm-hmm. And I love the statistic you said that, you know, only 7.2% of our body is actually our head. So how can we form a better friendship with this body-mind thing?
Well, the first thing is really to watch your thoughts about it. Because first and foremost, if you, that little 7% of your head, the mind that's in there, is telling you what it isn't, it's not as pretty as it used to be. It's not as toned as it used to be. It doesn't look as good. It doesn't work as good. Blah, 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 blah. If you're listening to that, you can tell you already, the relationship that you have is, it's something that you're judging rather than something that you're appreciating. You get one. This is it. The one you're in, this is the one you get for this lifetime. So when you understand that, isn't it amazing that our bodies can handle all the stuff we do to them and be resilient? Like, it takes a lot to have a body literally go offline, not in the total as in gone dead offline, but in terms of it puts up with a lot, it handles a lot before it cannot function because it finds compensation patterns. And that's really what those imbalanced tension patterns happen from, whether it's injury or just habits of being in terms of how we live in our bodies. But when you start to just pay attention to your thoughts about it, and then, wow, what if I actually treated my body like I do treat my best friend, right? Think about who you love in your life and how well you treat them. And now just make it a practice. What can I do today? One thing nice that I can do for my body. Is it making that choice that I'm not going to eat the junk and that I actually want to give my body and my brain could function on something I'm going to give it that it could use and my day could be more joyful? Or giving yourself rest, like turn off the dang phone. Turn off your phone. Like it's got an off switch, really. It does, and you can turn it back on. But in the car, turn off your phone. Don't have anything. Just be with yourself. Let that be your sanctuary to start doing things that you can start to show yourself an appreciation. Do things you love to do. Like if you like to hike or if you like to, whatever your form of movement is that it does give you joy, dance. Dance is a great thing. You don't have to, nobody's got to see you. Just put on your favorite music and start jamming, moving your head, moving your body. Just do something that is joyful, and you'll see that your body responds to every thought, every feeling, and everything you do. So when you start feeding it, it's like a 5-year-old that you have ignored, which is the case for most people, right? They ignore their bodies. So it's like a 5-year-old. Imagine you haven't given a 5-year-old attention forever, and now you lovingly start paying attention to it. The response you get, your body will, like the resiliency and the quickness with which it'll heal is exponential.
Now, Kathleen, how can we increase our ability to trust our body-mind?
That's a good question. The best thing is think of a time. So most people we don't trust our gut, or we don't trust our intuition because we have this loud voice that's clamoring all the time, the mind chatter voice. That's usually very loud and very critical. The other voice that's within us is this very quiet, still voice. So the trick is you have to put the little chatterbox over to the side and like a 5-year-old and say, honey, I'm going to put you over here for now. And then think about, just make a list of the times when you made a decision where you came from that place from your decision. So for example, you had a decision about what to do between two things, and you just really got quiet for a minute and you made a choice. It was calm. It was easy. It came easy. And you could feel it in your body. You could trust your gut. Like you're like, that feels right. And then just list those times when you've done that and then reinforce that so you can see, oh yeah, I do have that voice and it does serve me. I just need to start to pay attention more and ask it, what should I do now instead of the mind chatter voice? Say, okay, let me sink down and say, deeper self, what's the right thing to do here? And then you can see when you get grounded in your body, that opportunity for that kind of answer percolates.
That's just really wonderful. Now, going back to Kinessage, the system that you developed, is that just for people with chronic muscular pain, or can we all benefit?
It's everyone can benefit. So everybody's in a different place in the sense of it certainly works for chronic muscular pain, and it's great because it'll clear it out, reset it, and then you have a system to maintain better movement and better range of motion. But there's a lot of people who aren't to that point yet. The thing is that it'll happen over time. Just like, the reason why the posture of old age looks like the posture of old age is years of repetitive patterns, tension patterns in our body that get stuck. So I have a lot of clients who are, Gen Xers or baby boomers who have been active all their life. And now they're suddenly like, what's this? Now I wake up, I got this pain or that pain. So, or people who love to work out, but they'll start to work out and they'll have a muscle cramp, or they'll have, something where it's something that's impeding their range of motion. With this, if you think of it like learning, when you learn something in your body, first of all, you learn it on a deeper level because you're speaking the language of the body mind, which is movement and touch and movement. So that is not intellectual. That is not a theory. When you learn it in your body, it stays and sears into your nervous system. So when you learn the movements, once you learn them, it's applied knowledge. You have it for life because your body knows it. So it's like that cell phone thing. You take a minute and you kind of figure out how it works. And then once you learn it, now it just makes your life easier, because if you're on the run, you could be literally running in a marathon and your leg starts to cramp up, and you could do one movement and clear it. Or you could be on a bike ride, or you could just be wanting to get on the floor and play with your grandkids, and instead your hips a little sore, you can do one movement and release it so you can get back to doing what you love.
Now, you brought up something really important to know, which is that our kinesthetic movement, our kinesthetic memory is our longest term memory.
Correct.
No, it's our body actually remembers more.
Yes.
So, and I know when I'm doing hands-on healing, one of the things that I'll do is I'll put my hands on the body and say, remember what you felt like when you felt good. Remember health. Remember vitality.
Mm-hmm.
So what's your experience of empowering people to remember what it feels like to feel good? Because underneath the pain is a memory of what it feels like to feel
exactly good. One of the putting your hands on, when you're putting your hands on your clients, that is, and when I did that as a therapist, that is so important. So here's the most beautiful thing. We have our own two hands, and we can hold ourselves like we hold somebody else. So when you think about holding your dearest one, you can take that loving touch and put your hands on your own body, put your hands around your own shoulders, hug yourself, and say that. I remember, this body remembers what it feels like to feel good, and I invite you back. I invite that feeling back. I'm excited to live in that pain-free body again. I'm excited to appreciate how easily I move in my body. Using affirmations, when you use them with emotion, and then particularly when you add in the sense of touch, amplifies that message to the body. Because when we're born, the first thing we learn through is the sense of touch. So if you want to help remember what it feels like to feel good, use your sense of touch. Place it on, hold your own little face, put your arms around your shoulders. When you're laying on your pillow, just put your hand on the side of your face and hold yourself like you would hold someone else you love, and tell yourself, we're getting better. We have it in it. We're getting better. It's resilient. This body is resilient. I'm so grateful. And you start talking to your body like that, using those multiple senses, to use them to support us, just like we use them in the other direction. Miracles do happen, and they're happening because the divine life force that is animating our bodies and our minds and our hearts is who's listening. That's what's listening. When you're talking to yourselves, they hear that, and they're like, oh, I'm getting a new direction, which is I could be healthy. Wait, we could be healthy? Great. Let's immune system kick in, blood flow kick in. It all follows the direction of our emotions and our thoughts and our intentions and our actions.
I really, really appreciate your suggestion to anchor in positive thoughts with, touching yourself in a loving way, touching your face, giving yourself a hug, but because then you're combining the positive feelings and anchoring them in literally with touch.
Yes. And to your point about that specifically, for anybody I have clients if they have knee pain or wherever their pain place is, wrap your hands around it. So if it's your knee, wrap one hand on the top of your knee, the other hand behind your knee, wrap whatever part that is, if you can, with both hands, and sit with it. Sit with it and just sit with it. Tell that part that you love it, that you're grateful for it. And people oftentimes will tell me they feel heat because people hold anger in parts of their bodies. And if you think about it on a metaphysical and a physiological sense, inflammation, in essence, is anger in the body. So when you hold that place with love, you're helping to first release that heat, right? For that pain, that heat, whatever the expression of that is. And then you can then give that love. And I've had people literally do nothing else but that and stand up and have a difference in their knee. Now, when you take that and then you now apply that and then reset the nervous system by using Kinessage in a specific way that's actually resetting the conversation between the muscular and the nervous system, obviously it's exponential. So we're at different levels, right? We have that emotional aspect of the body that the body holds that manifests as pain, as well as the physical result of chronic tension patterns that result in pain. So it's about tag teaming, right, on every level to be able to release that pain.
What sort of conditions does Kinessage self-care help?
If you think of anything that's related to movement and muscular related, so musculoskeletal disorders cover soft tissue, which is what we're talking about, muscular, tendons, connective tissue stuff. In musculoskeletal disorders also apply to arthritis and bone stuff like osteoporosis. So Kinessage isn't going to change the structure of your skeleton. So it's not going to change bone spur. It's not going to change bone on bone rubbing on each other. But what it does do, especially for joint pain, is the connective tissue that's within a joint and surrounding a joint. As I said, if you have a muscle that's pulling tight on one side, it's going to change the force so that joint is going to be pulled on. When you release the connective tissue within and around the joint, what happens is the little nociceptors are called little pain nerve sensors that are throughout all your tissue. It's like unsticking saran wrap or shrink wrap, because we kind of get like shrink wrap over time and through our patterns. So when you release that, it allows the joint to have more space. So your nerves, your muscles, your arteries, your veins, your bones, your muscles, everything that is within connective tissue is now free to function. Your lymphatic system, your circulatory system is free to function better. So what happens is, even though it doesn't change the skeleton, right, it doesn't change bone on bone, what it does is when you can affect all the soft tissue, it dampens down that perception of pain because you cleared out everything else. And now you're just contending with the one source that is in the structure. So for people who do have, arthritis or other issues that are bone related, what they find is that while it doesn't change that, it does absolutely help the other aspects of the soft tissue that are all pulling on it and causing that to be worse.
And again, another common...
I'm sorry. So just to give you examples of that are sciatica, carpal tunnel, elbow, golfer's tennis elbow, neck pain, shoulder pain. So I can give you a couple examples for people to know, well, what is that exactly?
Yeah, exactly. And, again, commonalities in the way we think and the way that we treat people, because the first thing that I want to do when I'm working with people in their bodies, physically speaking, with movement, the first thing I want to do is literally create space.
Yes.
Because if you have pain, again, there's something that's going to be congested. There's some way where you're literally tightening up. And if you just think about creating space by lengthening your spine, lengthening and creating space for the nerves to flow, for the blood to flow, for the lymph to flow, for your energy to flow better, just that first thing is create space.
Correct.
And just like you brought it back to a question, what can I do right now to uplift myself? Another question to ask yourself if you're in pain, I think, is what can I do to create space?
Yes.
Can I lift my chest so that there's more space for my lungs to breathe? Can
Absolutely.
I lengthen my spine so there's more, space for the nerves that run through my vertebrae to work, right?
Absolutely.
Yeah. And so how long have you been doing Kinessage, Kathleen?
Well, it started with me in 1999, so 2000. 2000 was when I figured it out on me. And then I made it into the method. And then 2006, I started writing it all as curriculum to teach it. Started teaching it in 2008. And then and had simultaneously my practice and the teaching business through 2015. And then 2015 shifted gears to bring it to the public. So 17 years.
That's impressive. Now, I know you have your book, Release Your Pain, Expand Your Life, which is at KathleenGramzay.com. Do you also have online courses where people can learn this information?
Well, what I have is the system. So they can get the system, which is both the book and the movements. So the book will tell you how your body mind works. So it's a great owner's manual. But really for people who want to have the whole thing already done for them, no need to spend 17 years studying anatomy and kinesiology and proving it. It's already been done for you. So it's in the system, so you can have both pieces. You can have the book that explains how your body mind works, and then the movements take you through head to toe, scan down through all the deep muscles and fascia. All the kinesiology is already built in. You don't have to care about that. You don't have to worry about it. You simply place your hands how you're shown, do the movements, and you're just feeling and allowing yourself to get to know your body mind. It is it's all tactile. You're putting your hands on your body, you're feeling the difference, you're waiting for your nervous system to respond, and then it moves you down naturally into the deeper layer. You move into the next layer, you do the movement again, you wait for your body to respond, it lets you in further, and then you work down the deeper layers. So it's a complete system for anybody who wants to have a tool that is going to keep them flexible and aware in their body, and most importantly, keep that the chronic imbalance tension patterns from happening, and being able to have the force run through your joints appropriately so you can move and live in your body for as long as you're in it comfortably. And then you can, when your body's your partner, you can enjoy your life. You can do all the other stuff you want to do that when you're free in your body and in your mind, that life is more joyful, and you're free to explore the other aspects of what you want to do with your world.
I totally agree. And that's what we're here about at Natural Healing, is to empower you so that you can feel great naturally. And so last question, just briefly, can you tell our listeners one story about maybe somebody who was on a lot of medication, who was able to get off their medication and become pain-free with Kinessage?
Yeah, I'd be happy to. I did a program with a woman who, I'll tell you a couple stories. One is, this woman she's 40 years old, and I worked with her at a company. So I did a live training, and she came in and she was reserved, sat in the back of the room. She was heavy set. And so these were over 8 segments of 45-minute segments. And so the fourth one was, and she was quiet, and I just was mindful and paying attention to her. The fourth segment, so because tension just releases, the way that you test it is range of motion test, right? Because there's no big crack, there's no pain. So you see how you move and what range of motion and how much pain you have to start, and then you retest. So the test for this fourth one for back and torso was walking. So she walked up and back. And so we did literally 4 movements. And she gets up to walk, and she does, Catherine, she did a sachet, like a runway model sachet. And she literally gets up and says, I'm ready for the beauty pageant. And her whole, all her colleagues are like, Lorraine, this woman was quiet. She gets up and she is literally sauntering. She's like, you gave me my sexy back. And I was like, oh my God. So when she wrote the survey after the program, the sessions, she said that in 2005, she had been in an accident, and she had hurt her back and hurt her knee. So she hadn't been able to walk. She hadn't been able to either walk by herself or on a treadmill, nothing. She'd been on meds since 2005, and either from Advil to opioids daily since 2005, and hated it. And since the third session, the third segment of the series, so that took you through the upper body, through the hand, she didn't take any more meds. After the third one and after the fourth one, she does her Kinessage movements and goes walking with her husband every morning.
Oh, that is such
it's just amazing. And I had another woman who in her mid 50s, very fit, loves to hike, and she was looking at surgery. And she literally had her appointment scheduled to go do x-rays and stuff. And she found out about my system. So she got the lower body. She just did the lower body. 20 years she had hip pain. And she did Kinessage for 10 days. And it was completely gone. She can do her day hikes with no pain. And it's just, when I translated it to the public, I didn't know. I mean, my risk was, therapists could do it, and I'm working on people could do it, but could somebody who knows nothing about their body, would it work for them? And in the last year, I have testimonies, they're on my website for people to take a look at, but when I see that people who don't have any idea can follow it and their nervous system does the work and they get the same results, it just makes my life. It makes me so happy that it's already here. I've just put it into a system for people who do want to make a difference, who do want to have a change of lifestyle, and want the tools to empower themselves. I'm blessed that I got to be the person to bring that vehicle to the public. And it just, with every testimony, my heart just flows with joy.
You've been listening to the Natural Healing Show. And remember, when you put self-care and movement together, you can heal yourself naturally. Our guest today has been Kathleen Gramzay. You can find out more about her at KathleenGramzay.com. This is Catherine Carrigan, medical intuitive healer and Amazon #1 best-selling author. And Kathleen and I want to really encourage you to heal your pain naturally. The side effects of the opioids are very bad for your brain. They set you up for increased dementia, anxiety, and depression. So there's lots of tools available. You can find out more about me and my work at CatherineCarrigan.com and UnlimitedEnergyNow.com. While you're there, sign up for my newsletter to find out more about natural healing. Thank you so much for listening, and we'll see you next time.